Today, we are chatting about something that millions of Americans face every single day, especially when we age. It's something called cataracts. It feels like something's in front of your eye, maybe cloudy vision, maybe colors are blurred. You might need to speak with someone about it. I'm with Dr. Finch, you're with John Kenyon Eye Centers, and this is something that so many people face. They really don't know what it is. But what are some early signs of cataracts that people often overlook?
Yeah, so cataracts are something that happens to everyone, and especially as we age, it gets worse. So things that you can look out for that a lot of people don't realize are blurred vision, especially at nighttime. So you'll get a lot of glare and halos with oncoming headlights, street lamps even. You can have it with your TV just in your own household. And then as the cataract progresses, your vision can get dimmer. So a lot of times you need extra light to be reading as well. And so if you find yourself needing to change your glasses every year or turning on an extra lamp to read something, then that's probably what's going on.
Yeah, and a lot of times people just kind of push this off to the side. But what really differs from other eye conditions like glaucoma and cataracts?
Yeah, so a lot of eye conditions, most of them actually, can be silent. So you don't realize that you even have them, unless maybe that you have a family member. So you may have an idea that you could. So it's good to get an eye exam every year. Your provider can take a look. They do a thorough exam, dilate your eyes. That's a really good way to assess everything and the whole health of the eye. And that's where you'll see that you have a cataract.
And how does lifestyle choices like diet, UV protection, even smoking, how does that really influence the development of cataracts?
Yeah, so cataracts are inevitable, but there are definitely things within our life choices that we make that can progress them faster. So genetics play a part in it, can help that.
Right.
Smoking though, or any toxic chemicals, that can progress the lens faster. Your lens is made of proteins, and so as they break down or come in contact with anything that will break it down faster, that's how a cataract will form a little bit quicker. You also want to make sure that you're wearing sunglasses. Polarized lenses are great. UV protection for not only the natural lens of your eye where you're going to get that cataract, and then the retina, the full health of your eye. It's really important to do that. And then just having an overall healthy diet. I always tell my patients, eat the colors of the rainbow, even the gross green things, because that'll really benefit you.
Of course. I know carrots are really good for your eyes.
Carrots are good. Yep.
So how does cataract surgery, how has that really evolved? I know the technology has been really impressive lately. So how has that been to make this really a safe procedure for anyone?
Yeah, so it's a really wonderful, straightforward procedure. I have a lot of patients who come in sitting in the chair. They're so nervous. And I understand that, and we're there to walk them all the way through from beginning to end. So the first kind of set of cataract surgery was back in 5th century BC, and what they actually would do is take a little needle and just move the lens out of the way, which worked immediately, but then had a lot of complications afterwards. So of course we've evolved to much better practices. And so it is less than 10 or 15 minutes. You get a little bit of IV sedation just so you're good and relaxed, some happy medicine, and the surgeon and the team walks you all the way through the whole thing. And so there are portions that you can choose to have, like the catalyst laser, which is a great option. And so it makes an incision on the cornea, so it relaxes the cornea a little bit, and in a certain area helps with the refractive part of the surgery. And then it also makes the perfect opening in the capsule where the cataract is, and then it softens that cataract. So then the surgeon can safely remove the cataract and put in that lens implant that is good long-term.
Okay, so you're making patients really comfortable, because I know this can be so nerve-wracking for people, but it needs to be treated. So if people are interested in maybe getting in contact with the team, getting that appointment scheduled, how can people do that?
Yeah, so all they have to do is just call our number, contact our office, And one of our providers, myself included, will be happy to see them, walk them through from beginning to end.
All right, Dr. Finch, thank you so much for stopping by today. So again, if you're interested in learning more, just go to eyecenters.com.